You're very welcome back to the programme. It's 10:41. Now, recently, we have been hearing more and more about suicide rates in Ireland. Well, our reporter Aisling Riordan has come into studio. And Aisling, you have been digging down through the suicide figures in Ireland.
I have, Keelin. To start, figures released last week from a cross-border report indicate that the suicide rate among young people on the island of Ireland is one of the highest in Europe. Now, over 160 teenagers and young men died in the Republic in 2011, with 72 taking their own lives in the north. Now, the Young Men and Suicide Project found that the high numbers in both jurisdictions coincided with a deepening recession and rising levels of unemployment. If we look at official figures from the Central Statistics Office, the overall number of suicides in the Republic of Ireland began increasing in 2008, where over 500 people died. The initial figure for 2011 is 525, but this is expected to increase when the final figure emerges, and most experts in the field agree that even after the final numbers are published, the reality is numbers dying by suicide are even higher. If we break it down by gender, men are 3 to 5 times more likely to die by suicide than women. Irish men between 20 to 29 years of age are most at risk. And it's a problem for every county. From 2004 to 2010, Cork City had the highest rate of suicide, followed by Leitrim, Cavan and Carlow. Now, the government and the HSE are coming in for criticism in how they're tackling the problem. Groups within the area of mental health say 414 new posts were promised in the area of mental health in 2012. However, only 58 people had taken up positions as of the end of last year. Most of the 35 million allocated to develop community mental health teams in the government's A Vision for Change plan was used in other areas with cost overruns. It's also understood that €2.1 million out of a €7 million budget allocated for suicide prevention in 2012 was not spent. And if that's not all, it's been reported more than 2,000 children and adolescents are on waiting lists for appointments to access the mental health services in the HSE. Guidance counselling hours in schools were cut in 2011, and there were 1,200 fewer mental health staff in November 2012 compared to March 2009. Back to you, Keelin.
Thanks very much indeed, Aisling. Now, the other day, Martin Rogan, Assistant National Director for Mental Health with the HSE, came into studio and we asked him to respond to Aisling's figures.
There's no doubt these numbers are quite alarming, and certainly this is a major issue, not just a public health issue, but indeed a wider societal issue. And I think at last people are beginning to understand the complexity of the area of self-harm and indeed suicide. Across our population, Ireland is actually in the lower numbers in terms of the European instance, but certainly for young people, and as we saw in that report, in young men in particular, there are very high rates, and these are being addressed.
And Martin, can I ask you, is there evidence to say that these high rates of suicide could be prevented had we better services in place? What's the science say?
Certainly up to 2008, we were showing very good progress in reducing the actual rates of completed suicide. And a number of our initiatives there were very, very successful, certainly working with our partner agencies like the Samaritans, like PH House, like Console, and about 30 agencies nationally that we would support and fund. But also we've done some very good research on this as well. Ireland has some of the best research in this area, and we've invested in that arena too, because it's very important that your efforts are focused and that the evidence supports actually what you're doing is helpful and is valuable. And we know now, for example, of all the initiatives that are most useful, the ones that are probably most useful are in terms of working with general practitioners and primary care teams, in terms of the recognition of mental health issues and distress, and also then in restricting access to means by which people would self-harm.
And Martin, I suppose, if we know it works and we've done the research, why on earth did we take the money out of the budget last year? Why was that 35 million rated?
The 35 million is a huge commitment from government in terms of not just for our mental health service, but indeed for particular initiatives around self-harming and suicide prevention. As we know, this is a complex area and there's a multi-tiered approach. So we have our campaigns in terms of messaging with young people, our TV, cinema and indeed online campaigns. And then we also work with our partner agencies. And then we need to make sure that when people come for help, that the help is actually there and in place.
But back to the money, Martin. I mean, why was that raided? I mean, we all know the health service has got many, many needs. Everybody has a crisis. But why is it always the mental health services that the money is taken from?
Well, certainly, if you look at last year's National Service Plan, and indeed again for 2013, you can see that mental health has indeed been prioritised. So we know that significant funding has had to be taken back in the context of public service and public spending reductions. But mental health has been prioritised and has been focused in this area. But it's certainly, in terms of developing new services, you have to ensure that you don't abandon the old, and you must protect those. So certainly for vulnerable services like mental health service or indeed suicide prevention initiatives, we have to make sure the resource is held.
OK, so the 2,000 on the waiting list, would you have confidence that that will be dealt with in the coming months?
We're absolutely
you're talking
confident.
children there, some of those.
We're talking young people, and certainly about 20% of young people in Ireland will have a mental health need, but about 2% will have a psychiatric need. We've actually reduced our waiting list from over 3,700 down to 2,000, and most children are seen within 3 months. In fact, 40% of children are seen within 1 month.
OK, and will you hang on to the 35 million this year?
Absolutely.
Do you really believe that?
The 35 million from 2012 is recurring, and we've actually, the figures you stated earlier were at the end of year. Now at the end of January, we've actually got 193 of those staff are already in place.
OK, so even another 200 or so to find.
So we're making very good progress there.
OK, listen, Martin Rogan, thank you very much indeed for coming in to join us this morning.
And that was Martin Rogan speaking to me just the other day.